name is Marie, and I'm a nursing student at the University of Cincinnati. If you are seeing this video, that means that you've returned home or are seeking information on caring for your catheter, wound, and/or drain. We will provide you with everything you need to know as a guide and provide instructional reminders if you ever need them.
Hi, I'm Peyton. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
My name is JC. My birthday is 05/18/00.
Awesome. So I heard you had some questions for me about your Foley catheter. How can I help you?
Yes, I was wondering how often I should clean it and how do I go about cleaning it?
First, you must wash your hands with soap and water for 15 to 20 seconds before handling the catheter or bag to ensure cleanliness. Next, you will need to put on gloves. Use hand soap, water, and a washcloth to gently wash around the catheter tube in a circular motion. Be sure not to recontaminate the tube with the used parts of the washcloth by flipping the flaps of the washcloth back after one swipe. Repeat this 5 times and then dry the area with the dry washcloth. This is called the 5 and dry method. After cleaning the tube, you can now clean either the penis or vagina. For men, gently pull the foreskin back to wash the penis. When you are done, put the foreskin back into place. For women, wash the area around the catheter as well as the whole pubic area from front to back. You should be cleaning your catheter twice every 12 hours.
Okay, great. But how do I empty it?
Before emptying the bag, wash your hands with soap and water. Avoid touching the drain opening with your fingers and avoid tugging the tubing. Pull the valve out of the bag and place it over the toilet. To empty the bag, push the valve to the left. After the bag is completely emptied, turn the valve to the right to close it and place it back in the bag. Finally, wash your hands.
Does that all make sense? Can you repeat the steps back to me?
Sure. First, you're going to wash your hands
Okay.
and then go over the toilet and without tugging on the valve, remove it.
Okay.
Press the lever to the left, drain it over the toilet until the entire bag is drained, and then push the lever back to the right and gently place the valve back into its socket.
Awesome.
Now, how do I wear it at home or sleep with it?
When you're wearing the catheter at home, tape the tubing to your thigh and follow your healthcare provider's instructions for maintaining it. When you're sleeping, it is important to keep the bag below your bladder when lying, sitting, and standing. Be sure to keep the tubing secure. It is important to contact the healthcare provider if you notice any of these changes: feeling bloated or full and pain in the lower abdomen, red blood in the urine, cloudy urine drainage, unusual urine smell, fever, itching, rash, or burning near or where the Foley is inserted.
Now watch how to take care of your wound. Make sure to include any steps instructed by your healthcare provider.
Hi, my name's Izzy. I'm going to be your nurse today. Can you tell me your name and date of birth?
Chloe Davis, 5/22/01.
All right, and I heard you were going home today with a surgical wound on your abdomen. Can I show you how to take care of that?
Yeah.
To remove the old dressing, first we're going to wash hands with soap and warm water and put on gloves. Next, we're going to lift the corners of the dressing, slowly removing the tape by lifting the tape across the skin instead of straight up, and remove the dressing from the skin. Discard the old dressing. Perform hand hygiene and put on a fresh pair of gloves. To clean the wound, wet gauze with saline or water and gently clean the wound. Start from the center of the wound and dab in circles 1 inch past the edge of the wound. Do not clean from the outer edges of the wound back towards the center, as this could spread germs. Clean away any liquids from the room. Rinse wound with new gauze pad to remove any loose debris not removed from the first cleaning. Dry skin surrounding the wound with a clean towel. Check the wound for redness, drainage, swelling, or odor. New tissue at the bottom of the wound should be light red or pink. Use caution as the skin is fragile and will bleed easily. To apply the new dressing, open the new dressing and remove the package, being sure to only touch the corners of the dressing. Cut to size if necessary. Apply the dressing over the wound. Secure the dressing with tape. Dispose of gloves and wash hands.
Okay, great. So how often should I do this?
Around 1 to 3 times a week, depending on your doctor's orders. And can you repeat the steps back to me for your procedure?
Yeah, so first I'm going to start with hand washing.
Here are some things to consider. Make sure to wash hands when completing at-home wound care. Keep the peri-wound dry when applying new bandages. Check the wound for redness, drainage, swelling, or odor. New tissue at the bottom of the wound should be light red or pink. Use caution as the skin is fragile and will bleed easily.
I'm happy you've learned how to appropriately perform catheter and wound care. Now, let's go over the last section. Please observe how to perform proper drain care.
Howdy, my name's Chloe and I'm a nurse here. Can I just get your name and date of birth?
My name is JC. My birthday is 05/18/00.
Awesome. So I hear you're going home with a JP drain and I just want to make sure that you know how to properly take care of it. Is that okay?
Sounds great. I would love to learn.
Awesome. Are you ready to go over some aftercare instructions?
Yes, ma'am.
When changing the dressing around the drainage site, start by washing your hands, then removing the old dressing, and then putting on new gloves. Then use a wet gauze pad or wet washcloth and warm soapy water to clean around the drain by making circles around it, starting close and then moving away from the incision. Pat dry if needed. Lastly, if needed, apply a new sterile gauze pad to the site. You will know it is time to drain the collection device when it is about 1/3 or 1/2 re-expanded with air and fluid. To drain the collection device, wash your hands and apply clean gloves. Then take the cap off the device, being careful not to touch the spout, and dump the fluid into a disposable measuring cup. To close the device, squeeze it while simultaneously recapping it to create a vacuum. Lastly, wipe the area around the closed cap with an alcohol swab. Some things to consider when taking care of a JP or hemovac drain. If you notice new or worsening redness, swelling, heat, or tenderness at the drainage site, let your doctor know. Be cautious of pulling on the tube and always make sure to keep the drainage collection device below the site of the drain insertion.
You've now seen exactly how to care for your catheter, surgical wound, and/or drain. Remember, and most importantly, your health as the patient is the most crucial aspect. So, if you have any questions or concerns, do not fear reaching out to your healthcare professional for clarity or further instruction. Thank you for watching. Sources used in the making of this video include Teaching Wound Care to Family Caregivers by American Journal of Nursing. This article provided useful and simple instructions that nurses ought to reference with family caregivers who perform wound care tasks. A second source used in reference to health literacy is Association of Health Literacy with Post-Operative Outcomes in Patients Undergoing Major Abdominal Surgery, taken from the National Library of Medicine. This article highlights the importance of health literacy in preventing post-surgical complications and the obvious correlation between an increase in health literacy and a decrease in post-abdominal surgery complications and negative outcomes in patients.